with my brand, people will ask me, oh, who is this targeted for? Is this targeted for older women who already have the problem? And I say, no, these products are for to start young. You don't want to wait until you already have the problem.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Your skin around the eyes is the most delicate skin around your entire body. So, the products we should be using around our eyes should be friendly and safe, such as our mascaras, our eyeshadows, our eyeliners, our lash serums. We invest in so many other things for our appearance and our makeup, but we don't invest in eye friendly products. So today I have with us the founder of an eye friendly line called 2020. Dr. Hilal-Campo is an ophthalmologist, and after treating patients struggling with dry eyes and other painful conditions caused by makeup and beauty treatments, she developed her own brand of eye-friendly formulas called 2020. Welcome, Dr. Hilal-Campo. Thank you so much for being on. I truly, truly appreciate it and your time today.
My pleasure. It's an honor to be here with you.
Thank you. So tell me, how did 2020 Beauty arise? How did you think of the idea?
Well, I'm a board certified ophthalmologist. I started my practice right out of residency, and after over 20 years of seeing patients and seeing their complications from their eye makeup and their beauty habits, I knew that there needed to be something done in the industry. Again, we ophthalmologists would talk about this at our conferences, how there was a huge increase in patients who had dry eye, 80% of them women. Over the past 10 years, it's grown, it's tripled. And again, we postulated that it was caused by the ingredients in eye makeup. Especially since there was such a high preponderance in women. Meibomian gland disease became obvious as a big problem leading to dry eye. And again, the meibomian glands can be affected by products that we use around our eyes and in our eyes. So I wanted to make a line. I wanted to make eye makeup that had healthier ingredients, that had a focus on hygiene, because that's another big issue that we saw. Is we saw that a lot of people were getting eye infections and infections, Demodex infestations and blepharitis. All of this is caused by poor hygiene, using the beauty products and not cleansing the eyelashes well. And so I wanted to focus on hygiene to help keep patients, out of my office, basically, because I'll go over some of the diseases that, when you have poor hygiene, again, Demodex, blepharitis, it can lead to corneal ulcers, staph ulcers. It can lead to, again, pink eye, styes also styes. So it became very important to me that my products had a focus on a good hygiene. Then I wanted to do better product design. I wanted products that performed well and helped enhance the beauty of women's eyes, but that had a smarter, more intelligent product design. So, for example, powdered shadows, there's fallout. Every time you apply it, you get fallout into the tear film. And when you get the fallout into the tear film, the chemicals leach into the tears onto your ocular surface. Number one, you can have irritation from it. But number two, more seriously, with time, it can cause scarring. When you pull down a patient's lower lid, this is called the inferior fornix, or flip the upper one, the superior fornix, you can see pigment scarring from eye makeup. And I wanted smarter product design as well. And that's basically what my thought process was. And I was lucky enough, I tried to do this on my own. I live in New Jersey and we have labs here.
Mhm.
And I approached the labs. I went to a patent attorney. I tried to do it on my own. But basically, the labs don't want to talk to you if you don't have a history in beauty and you're not a
Oh,
big
wow.
like Revlon. They will not. They did not want to talk to a single doctor.
Mhm.
Solo practitioner. So I really got nowhere. And then fortuitously, I had a patient who had been in beauty for about 20 years, who had gone to a few different doctors, been misdiagnosed, and I diagnosed her correctly. And I had to see her every, few times a week. By the end of about 8 weeks, when
Right.
everything was sorted out and she was doing well, she felt comfortable. She told me that she worked in beauty for over 20 years. So, and then I said to her, "Oh, wow, I would really love to make a line that focused on healthier ingredients and better hygiene and better design." And she said to me, because I've seen
Right.
so many complications over the years. And she said to me, "Wow, that's brilliant." She said, "All of my friends in beauty have problems with their eyes and cannot tolerate the eye makeup for very
Yeah.
long."
Yeah.
She said, "And my mother has horrible dry eyes." She said, "There's nothing like it on the market. Give me your cell number and I'll help you to make your dream come true." This was a passion
Wow.
project.
Yeah.
So she introduced me to a team of women who basically are my team. And without this team behind me, I could not have done it. So again, this is truly a passion project. I'm self-funded.
That's
I,
amazing.
this team, they're experts in every little thing. So I have somebody who's an MBA. She's my brand head. I have someone who is a formulator. I have someone who is
Wow.
a regulator. I have someone who's a social media expert. I don't know anything about social media. In fact, I didn't even have any social media presence.
Yeah, yeah.
I had no
Me
social media
neither before this.
before this. I'm a doctor. So
Yeah.
suddenly I had a social media expert, and now I have Instagram and Facebook. I also brought in, so I also needed someone to do photography and videos and TikTok videos and photography. And I had a patient who was a young woman who I had treated. She had done makeup videos as a kid. I
Right.
took care of her whole family, did her grandma's cataract surgery, and she, I took care of her when she was a teenager. Then she went to college, and I said to her mom, "What is she doing now?" And she said, "Oh, she's doing videography for a company, but I think she's not that happy." And I said, "Oh, do you think she would be interested in working with my company?" And she said, "I think she would love it." So she's
That's
now part of my team.
that's
So
amazing.
you
Yeah.
bring in resources. Um,
It takes a village, but it can
it takes
happen.
a village. I couldn't do it by myself. I
Absolutely.
knew I was a chemistry major, so I knew what ingredients I didn't want in. I knew the
So do you
complications.
mind touching on those ingredients that you did not want in? What were the big
So
no-no
a big
ingredients?
thing is preservatives. Okay, the
Okay.
preservatives are very bad for the ocular surface. Again, it's one thing when you talk about, people talk about clean beauty, but
Right.
clean beauty is really not a standardization. Okay, um, it's kind of a basket term. So what I'm looking for, my ingredients are ingredients. My benchmark is. It's safe for the ocular surface. It does not damage the ocular surface. So that's a big benchmark that other brands do not meet. So that benchmark, as well as my ingredients are all vegan, cruelty free. My ingredients are all, I do not use anything that is a hormone disruptor. I don't use anything that's possibly carcinogenic. Um, I don't use anything that can be harmful to any of the eye structures at all. I'm formulated, in the US, the FDA only regulates very few ingredients, like 13 are
Oh,
banned,
wow. Yeah.
whereas in the EU, about 1300 are banned. I'm formulated to EU standards as well as a blacklist that of anything that can affect the ocular surface. And again, some of the ingredients, okay, that I don't like. Number one, I don't like anything that are harsh preservatives. If I can avoid a preservative, I do. For example, my hygiene spray, and again, as I was telling you, hygiene is very important when it comes to the eyes. And one of the the first products that I had is something called hypochlorous acid spray, my daily hygiene spray. It's made of a natural ingredient that's made by your neutrophils, your body, to fight invaders. So the substance kills 99.9% of bacteria within 1 minute. Okay. In fact, it was approved by the EPA in March of 2020 to kill coronavirus on surfaces.
Wow.
It doesn't need a preservative. It is its own preservative.
Yeah.
Okay? So it doesn't need a preservative. And it's safe for your ocular surface. So as a mainstay of every person's beauty routine, they should have this spray as part of it. If you spray it, okay, either with your eyes closed or your eyes can be open, okay, and let it air dry twice a day. You can also put it on a cotton round or a microfiber cloth.
Right.
And scrub your eyelash bases with it. Okay. And turn it around and do the other one. Scrub your eyelashes with it. This is the best way of keeping bacteria away from your eyes. You would also, I recommend, people are not cleaning their beauty applicators well enough or often enough. Okay, or often enough. So this is a sanitizer. You can clean the applicators with baby shampoo, warm water, and then you spray this on, and it's a sanitizer. Okay, and this will help keep bacteria, demodex. Demodex are mites. We see these in eye doctors' offices every single day, and every single day we see the complications. Women who have those lash extensions. They don't clean their lash extensions or the base of their lashes at all. A lot of them don't.
Yeah.
And a lot of them at the base of the lashes, they have horrible infestations of mites and blepharitis. And using this daily hygiene spray will not make the lash extensions fall off. And it will keep the base of the lashes clear of all of those bacteria and mites. For those patients, I would tell them to also put it on a Q-tip and clean the lash
Clean
base.
the base of the lashes.
Yeah.
It's funny. I had a patient yesterday who said to me, so it's interesting what you said. She said to me, I don't wash my face at night because my makeup just evaporates. And I'm like, what? How does your makeup evaporate, right? So a lot of women are not cleaning their makeup at night and removing it appropriately. Before even doing the spray, they're not even removing the makeup, and that's blocking all the glands and everything. So
Exactly.
I can't stress that enough that you said that.
Yeah, it's true. Women's hygiene, it's not stressed enough. Another reason why I started this is I wanted to use it as a platform to educate the KOLs, the key opinion leaders, who are the beauty editors, okay, to educate them. And they are shocked when I talk to them about these things. They have no idea. So this was very important to use this platform, and I thank you for interviewing me to get the word out. And it's to get the word out to the general public, to get the word out to beauty editors, to get the word out to even other doctors. I mean, basically, it's easy to discuss this with other women eye doctors, but it's a little bit more difficult when you try to explain it to male eye doctors. And I know because they don't. A lot of them are not wearing makeup. But once you start talking to them about it, and then they go back and they look at their patients, I've had them call me
And
and
say,
say, thanks to you, this young girl is on a better route,
yeah.
Again, TikTok, social media has also made things much more dangerous. It's up to the ante.
Right.
Okay, it's
Dangerous
up
is a
to
big
the
word.
ante. So that was the other, these are the things that have come about over my lifetime that have made things so much worse, so much worse. The popularization of dangerous beauty practices, even, lining the waterline, okay, which is called tight lining. That is extremely popular. When I would tell beauty editors, this is very bad. It blocks the glands that makes the oil. It can kill those glands. You're only born with a certain number of those glands, the meibomian glands. And once you kill them, they're gone.
Yeah.
They're dead. And again, 80% of dry eye is because of meibomian gland disease. It's usually a combination of meibomian
Right.
gland disease and aqueous dysfunction. But you need those glands. And
Absolutely.
all of these products are damaging, and the way that you use them damages the glands. I mean, not even to talk about some of the using the lash extensions, the glues are dangerous. The glues damage, number one, they damage the lashes. When patients try to stop doing the lash extensions, I see stubbles in the slit lamp, which is a microscope. Stubbles for lashes. And then those, that's not good, because our lashes are there to protect our eyes, to keep dust, to keep bacteria away from our eyes.
And the problem is it's happening with younger and younger patients, right? Younger and younger patients are getting into those false eyelashes extensions now. But also the TikTok trends of the not so great or the dangerous beauty products you were talking about is really high up there. So I worry about these atrophied meibomian glands for, the younger population, because by the time they're 40 or 50, and, sometimes we'll show patients their meibography and we'll show them that, you have 60% atrophied glands, and they'll say, oh, but that's okay because you can help me. And I said, what's atrophied is atrophied. We can only preserve what we have and take care of what we have left. And that's the scary part, is until you're doing those kind of showing your patients meibography and showing them these glands that are atrophied, a lot of patients don't understand.
Exactly. And I've seen it with young women, and it's scary. And a lot of these youngsters are starting 10 years old,
Yeah. Oh
10
my
years
gosh.
old,
The Sephora
starting.
trend.
Yeah. And they don't, and that's why, with my brand, people will ask me, oh, who is this targeted for? Is this targeted for older women who already have the problem? And I say, no, these products are to start young. You don't want to wait until you already have the problem. You want to try to use the product so you don't get the problem.
Get the problem.
You know, Another thing that people don't realize is retinoids. Retinoids damage meibomian glands, and that means topical retinoids as well as oral Accutane. But the oral Accutane, we all know, does. But a lot of women are using retinoids, and younger women, kids, retinoids. Around their eyes or even on their face. The problem is when it's on your face and you sleep on the pillow, it migrates and it gets
Yeah.
around your eyes. So, and retinoids, we know, damage the glands,
Yeah.
damage the meibomian
And
glands.
the skin around the eye is the most delicate and the thinnest, right? So I think that's key as
Exactly.
well when we're using retinoids around the eyes.
Right. You should definitely not use them around the eyes. But again, using them on the face, it might, if you're using it before bed and it gets on your pillowcase, it's also getting around your eyes, most likely.
Right.
I also try to stay away. Getting back to ingredients, I'd also try to stay away because the skin fibroblasts can turn carotenoids into retinoids. Okay,
Okay.
so carotenoids are also they're plant-based vitamin A precursors. The skin can turn it into retinoids. So
Interesting.
I stay away from any kind of ingredients that are high in vitamin A, like
Okay.
jojoba, aloe vera, things that you might find in other skincare or eye brands. I stay away from, so, and I use oils that are low in vitamin A rather
Okay.
than some of the plant-based. I do like natural oils, but you have to be careful. Like, I'm very careful with the ingredients that I use, and you need to use ones that are not high in vitamin A, or carotenoids are the plant version of vitamin A on the skin. You have to. I'm very careful with allergens. One of the biggest problems with mascara, and that is the biggest complaint that women have. At the end of the day, they cannot tolerate their mascara. And that's because of all the allergens that are in most mascaras. For example, most of them have wax that is either carnauba wax or beeswax. Now, anyone with a pollen allergy, if you put beeswax, which is what a lot of mascaras are based are beeswax, you're going to have irritated eyes by the end of the day. So I stripped those. And carnauba wax is another huge one. It's also plant-based, but it can be highly allergenic. And when you use that in a mascara, patients are very irritated. So my mascara, I've had so many letters from patients, emails, saying how happy they are that they're able to tolerate. They have not been able to tolerate mascara. One woman said she had tears of joy because it was for her son's wedding, and this was the first time that she'd been able to tolerate a mascara. I mean, that's very touching when you get
rewarding,
these. Yeah, it's rewarding when you get these notes. But again, allergy is associated with dry eye because it causes inflammation. So you want to, I try to strip my products of as many allergens as possible.
So tell me, like, the newest trend is now lash serums, right? And we all know that a
Right.
lot of the lash serums are, prostaglandin-based. And, there's a lot of side effects of the prostaglandins, like your sunken orbits, your hyperpigmentation.
Right.
So tell me about lash serums. Should people be using lash serums, and what type of lash serums should they be using?
Okay. You have to be very careful. Okay. What you're using. Okay. So I'm not young. I've been in practice over 25 years. I was there at the start of the glaucoma medicine Zalatan, which is,
Wow.
which
Yeah.
is the very first class of drug, is the very first drug that was made in that class.
Right.
Okay, so they're called analogs of PGF2 alpha. Okay, now PGF2 alpha analogs, that's the class that causes, and that receptor, the PGF2 alpha receptor, is the class that causes all of these side effects. Okay, there have been studies done. So it started as a glaucoma medicine, very, very effective, 30 years ago. And then the eye doctors all saw the side
Right.
effects.
Right.
Pigmentation of the skin around the eyes. Yes, it grew eyelashes, huge eyelashes. Patients also got red eyes. Patients also had, some of them, changes in their eye color. Patients would also have sunken eyes with time, eyes, and the lid crease was raised
Right.
because it causes fat atrophy of
And
the
so you look
orbital
older
fat.
when you have that
So,
happen. I want to stress
so,
that.
so basically, Allergan, which was a company, took that and they made it into a lash serum, the first one, Latisse, that had to be, because this class of drugs was a glaucoma medicine, bimatoprost, it had to be prescribed by an eye doctor. Okay. Well, and then if your eye doctor prescribed it and you went to your eye doctor and your eye doctor started to see these things, the eye doctor would say, stop it. Okay. Well, the smart companies decided to make cousins of the
Right.
FDA regulated drug. They made cousins of it, 10 times stronger, with the same side effects, and not under FDA control. They went into the over-the-counter serums. And
Yeah.
our patients started coming in with red, irritated eyes, dry eyes. It also causes damages the meibomian glands, dry eyes, irritated eyes, discolored skin. And we would say, we
What's
didn't
going on?
prescribe you. What's going on? And then the patients would come in and say, oh, I'm using this. I'm just using these vitamins on my eyes. Oh, let me see those vitamins. And then you look and you see, and you start to Google the list of the ingredients. The ingredients, it doesn't say, oh, we have a PGF2 alpha analog in here. But once you start to Google the ingredients, you find that hidden in the ingredient list is one of these prostaglandin, a PGF2
Wow.
analogs. And there's no disclosure to the general public about the risks, the safety issues involved.
Right.
And we know from the glaucoma usage that these side effects are not rare.
Right.
They're not rare, especially when you're using these things every single day. They're common. They're common. Um,
So should people be avoiding lash serums
So
altogether?
in my opinion, you have to be very careful what the lash serum is. You have to look at the ingredient list. Okay. So a lot of them, if they're aqueous based, they need a preservative. A preservative is irritating and not great for the ocular surface. If you look at the list and you Google it and you find anything in it, and like, for example, isopropyl chlorprostonate is a big one that
Right.
if you Google and you find that it's an analog of PGF2 alpha, prostaglandin analog, you should not use it. You should not use it. There are some, though, that just have peptides, or ones that have moisturizing, like hyaluronic acid
Right.
ingredients. Those are okay. Those don't cause these side effects. So you have to be careful which one you use. Now, mine, and this was another reason why I started my line, because I was very upset, that this was happening. I didn't know initially this was happening. And then I realized it after seeing patients come in time after time with these issues. And then it turned out because they're using these,
Right.
they think are vitamins, and they're not.
Yeah. Yeah.
Now my lash serum, I initially made this as a treatment for dry eye. So I had men on it, women on it. At night before bed, I would have them with clean fingers put a little bit of cold pressed hexane-free castor oil into their lids and their lashes. I did that because the racinoleic acid, number one, it binds to receptors on the conjunctiva that downregulate allergy and inflammation. And then number two, it would go through the thin eyelid skin and stabilize the outer tear film. So patients would wake up with their eyes feeling great. But in addition to that, their lashes would grow. And then my patients started putting it on their brows, and they
Interesting.
grew.
Yeah.
So, I researched it and I found they're not 100% sure of the mechanism, but it seems as though it binds to receptors that increase blood flow to the base of the lashes.
Okay.
That's how it works. In addition to that, I added in a little a little bit of argan oil, which is extremely hydrating because it has linoleic acid in it, very hydrating for the lashes, and a little bit of coconut oil, which is a natural antibacterial. Again, bacteria and blepharitis at the lash bases also reduces lash production and has your lashes stunt
Right.
their growth. So castor oil actually has been shown to be extremely effective also at treating blepharitis, which is another, it
Yes.
works in several different ways.
Yeah.
So that's one mechanism of helping the lashes grow. Another one is possibly increasing the blood flow. Also adding in these moisturizers. Brittle lashes break, hydrated lashes don't break. Because it's a combination of oils, it does not have a preservative. It doesn't need one. Okay. Anhydrous combinations of oils do not need preservatives. So this is much safer than other lash serums because most of them are aqueous based and require a preservative, which
Right.
again damages the epithelial cells of the conjunctiva, the cornea, and can be very irritating. So my serum is not irritating, does not contain a preservative, and it works. So
Amazing.
yeah. So
Yeah.
I also, like, as I said, I wanted smarter product design. So basically, you're not, another problem with a lot of the serums is you're double dipping. You're double dipping with the applicators. With
Right.
mine, I have you with clean hands. Absolutely. You can use a soap that's high in BAK, like Dial, to clean your hands, or you spray it with my hypochlorous acid spray, and then you put on, you pump it. So if you pump it, you're not double dipping, and you just apply it with your fingers to your lids and your lashes. Patients wake up, or people will wake up, their eyes will feel great, and their lashes will grow, and their brows grow as well. So
Amazing.
that's how my serum came about. Again, it came about in that way. The
Amazing.
only caveat I would say is that sometimes oils, people can be allergic to it. So I want people to patch test it before they use. Really, you should patch test
Precious. Everything.
anything
Yes.
that you use around your eyes. Again, if you have any, an allergic response, it will be irritating, and it will cause your eyes to be. It's not good for your eyes if you have an allergic
Right.
response. Well, it will start the inflammatory cycle and make a dry eye worse.
Right. So, I get a lot of younger, demographic now, the teens and, the tweens, wanting to do lash serums and wanting to do these makeup products. It's a big fad. So a lot of them also talk a lot about their under eye circles. Do you have any,
Yes.
tips on ways to help with their under eye circles? Because that's,
Okay.
whether it's genetic or, lack of sleep, a lot of them want to help with that pigmentation.
Okay. So the under eye darkening, it depends on why their under eyes are darkened. If the lid skin, as you said, is very thin. So a lot of times it's not a true pigmentation of the skin, but it's basically because the vessels underneath are engorged and are showing through the thin lid
Hmm.
skin. That you can help with. Okay, you can use things that constrict the vessels. Okay, for example, are my I like natural things. So
Right.
if you put cold, so I have a roller brush that you put in the freezer, and that's cold. And if you do that, okay, number one, it will help disperse. Let's say with allergies. With allergies, what happens is that you do get an engorgement of the vessels, the veins, and you do get leaking of the vessels. So you will get fluid that comes out.
For
So
the
by
puffiness.
using the
Mhm.
roller brush that's cold, it disperses the fluid and it vasoconstricts the vessels. So that will help you. That will help you. A lot of eye creams have caffeine in them, which vasoconstricts. That also helps to take away the discoloration. Now, when it's pigmented, that's a different story, and that I really don't have a good
Yeah. Yeah.
solution for pigmented. And again, you can get pigmented hyperpigmentation from inflammation, chronic inflammation. Okay, can give you, or these lash serums that have these other products, these PGF2 alpha analogs in them, can also cause the hyperpigmentation. And when you get the hyperpigmentation, there really isn't a lot you can do.
Yeah. Can
Uh,
we go back to the rollers? So the rollers are to help, with puffiness, your allergy symptoms,
Depuffing,
like.
allergy. Also, when you get engorgement of the veins, it helps with that because it vasoconstricts them. So
Right.
your eyes look better. They look less, you less of the dark circles underneath. It's helpful.
But is the key that it needs to be in the fridge or the freezer before
Freezer.
taking it out? Yeah.
Yes.
Okay,
Yes.
because I didn't know that. So that's
Oh,
a good
that's
point.
key. You want it to be cold. It's not
Okay.
chemical. It's
Right.
not chemical. And again, there are some chemicals that will vasoconstrict. I try to stay away from chemicals as much as possible and be natural.
Right.
So that's the other, again, because, what are the long term effects? Again, with other drugs, we know that you can get when you use a vasoconstrictor as a drug. We know that long term with some of them,
Right.
you can get a rebound hyperemia, a rebound in inflammatory effect, weakening of the vessel wall, and long term the chemicals don't work well. So I try to use natural.
Yes.
Um,
So another good point that you mentioned was about that. So a lot of patients who are coming in with red eyes, are using drops like Visine or vasoconstricting drops, which is causing this rebound redness. So it's better you see your eye doctor and analyze whether it's dry eyes, allergies, what's causing the underlying issue, or your makeup, the
yes,
underlying redness,
yes,
before constantly using these vasoconstricting eye drops.
yes, absolutely. I mean, you really should. Eye doctors are your friends. And so many diseases and so many things can be diagnosed. I've diagnosed brain tumors. I've diagnosed multiple sclerosis. I've diagnosed sarcoidosis. So many diseases can be diagnosed through an eye exam. And so many people don't go, you know.
Right.
And again, we're there to help. Um, and it's important. And if you have a red eye, you don't want to be treating that on your own. You may have blepharitis. You may have an underlying dry eye. And a lot of times these things are just, vasoconstrictors, Visine, will just mask the real problem. And long term, as you said, will cause damage to the vessel wall. Um, yeah. So
So, I have to ask you, what is your makeup routine or your skincare routine? Put
very
you on the spot.
I know, I know. So, very simple. I'm not coming at this from the side of a beauty person. I'm coming at
Right.
this as a side from a medical perspective, and
Right.
I've never been a big makeup wearer. Most doctors are not. You know,
Hmm.
I've never
Hmm.
been a big makeup wearer, so or anything with skin routine. So basically, I prior to my now I use my line. Okay, now
Right.
I use my
Right.
line. But prior to my
So are
line,
you using, sorry, do you mind touching on like what are you using in your line?
okay, so right now I have on my visionary eyeshadow sticks. So I love my sticks because they're quick and easy. I mean, as I said, I don't have a lot of time.
Right.
So you can with my sticks, you can just use one or you can blend them. I have three on right now. Um,
Wow.
I have rose colored glasses, love at first sight, and at a glance. And then I lined underneath with at a glance. I also have on, okay, so another product that I made was my brow gels. I made my brow gels because at my age, and I'm a lot older than you are, when I dye my hair, my brows get gray much earlier, which is common in my age group because the dye of your hair lasts about a month. The dye on your brows only lasts about 2 weeks.
Right.
Okay. So, so I made my tinted brow gels. So my brows at this point would be gray, but I'm using my tinted brow gels and it has a little bit of castor oil in it so that my brows are a little bit bushy. Okay. Because of that.
Wow.
Because when you get older, another thing that young women don't realize, your
I'm not
brows,
that young, but yeah.
you look young, your brows thin out, your brows thin out.
Right.
Then I have on my mascara, okay? And basically, and I have on a lipstick right
Oh,
now,
very nice.
and a little bit of a base. That's it. I don't have any rouge on. I don't have a lot of
Nice.
makeup on, but I
That's great. And I think your line is mostly for that natural look, which I love.
yes,
I think your line is more natural, enhancing your natural beauty, which is amazing. So
yes.
tell us where can our listeners, viewers find your products?
Okay, so um, I am distributed out of, I also wanted to do a new distribution model. So, as a new distribution model is that I am being distributed out of eye doctors' offices. So, I'm
Very nice.
distributed out of 700 eye doctors' offices in the US and Canada.
Wow.
In addition to that, you can get the products on Amazon or on our website, Try2020. So TRY20ENTY.com. I'm not being sold in retail yet. So it's direct to consumer on websites, Amazon or our website, or through your eye doctor's office.
Amazing. So I would encourage everybody to give it a try, for the sake of their eye health and the thinner skin around your eyes. From two eye doctors, we're definitely advocating it, to help, especially the preservatives. I think you hit the nail on the head. That's a big one. So thank you for your time today, Dr. Hilal-Campo. I really appreciate it and appreciate you educating everybody.
Thank you so much for having me on. I so much appreciate it. And it's been wonderful being here, and it's so nice to meet you.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.